Welcome to the Baby Therapist's Crash Course, where we help you navigate the wild world of counseling and crush those board exams with confidence. Whether you're fresh out of grad school or knee-deep in client sessions, this podcast is your go-to guide for mastering the skills you need to succeed. I'm Tia Marie, your host and fellow baby therapist, here to break down complex concepts, share study tips, and get you exam ready without the stress. Let's dive in. Understanding panic disorder and effective treatments. Welcome to today's episode, where we're diving into a topic that affects millions, yet often remains misunderstood: panic disorder. Have you ever felt like your heart was racing, your breath shortening, and your mind spinning out of control? Almost as if something catastrophic was happening, but you couldn't quite place why. Well, you're not alone. Panic attacks can be absolutely terrifying, and for some people they happen over and over again, without warning, in the middle of daily life. But what if I told you there are real, effective ways to manage these symptoms and get your life back on track? That's what we're unpacking today. So buckle up, stay with us, and let's break it down. Panic disorder is one of those mental health conditions that can seem almost impossible to live with. Imagine experiencing sudden, overwhelming fear, complete with physical symptoms like heart palpitations, sweating, dizziness, and the fear that something terrible, like losing control or even dying, is just around the corner. These are panic attacks. And for people with panic disorder, these attacks happen frequently and unexpectedly. Not only do these attacks create intense fear in the moment, but they can also lead to something more, what we call avoidance. People begin to avoid places or situations where they fear a panic attack might strike. This can spiral into agoraphobia, which is essentially the fear of being in public spaces, making it hard for people to go about their daily lives. In today's episode, we're going to explore how panic disorder is diagnosed, what treatments are out there, especially cognitive behavioral therapy, CBT, and how therapists work with clients to break the cycle of panic. We'll also touch on some tips for mental health professionals when diagnosing and treating panic disorder. Part 1. Symptoms and diagnosis. First, let's break down the symptoms of panic disorder. If you or someone you know has ever experienced sudden, intense fear that seems to come out of nowhere, along with physical symptoms like a racing heart, shortness of breath, or a sensation of dizziness, you might be familiar with a panic attack. Some people describe feeling like they're having a heart attack, or even dying during these episodes, and that's why they're so frightening. What separates panic disorder from just an isolated panic attack is the recurrence of these attacks. People with this condition aren't just dealing with one or two instances. They experience these attacks regularly. And because they're so unpredictable, many individuals start avoiding situations that might trigger another attack. This avoidance behavior can grow over time, eventually leading to agoraphobia, where even going outside or being in a crowded place feels unbearable. When diagnosing panic disorder, mental health professionals look for this combination of recurrent panic attacks and avoidance behaviors. But there's more. There's also the need to recognize the potential for agoraphobia as a comorbid condition, meaning it can exist alongside panic disorder. Part 2, Cognitive Behavioral Therapy, CBT, as treatment. Now let's shift gears and talk about treatment, because there's good news. Panic disorder is highly treatable, and the gold standard for managing it is cognitive behavioral therapy, or CBT. Why CBT? Well, it's all about changing the thought patterns that fuel the disorder. CBT focuses on two key areas: restructuring catastrophic thoughts and reducing avoidance behaviors. So, what does that look like in practice? Cognitive restructuring is one of the main techniques. People with panic disorder often have catastrophic thinking. During a panic attack, they might think, "This is it, I'm going to die," or "I'm losing control." With CBT, the therapist helps the client challenge and change those thoughts, learning to recognize that while panic attacks are uncomfortable, they are not life-threatening. Interoceptive exposure is another technique. This one sounds fancy, but it's really about helping people confront the physical sensations of panic in a safe, controlled way. For example, a therapist might guide a client to purposely experience dizziness during a session. Why? To teach the brain that these sensations aren't as dangerous as they feel. Finally, we have exposure therapy, which is all about gradually helping clients face the situations they've been avoiding. For example, if someone has stopped going to the grocery store because they're afraid of having a panic attack, the therapist will help them gradually reintroduce that experience. Starting with something small, like just walking past the store, and eventually building up to shopping again. CBT really aims to empower people to take back control, and therapists working with panic disorder clients tend to favor CBT over other methods like systematic desensitization. Why? Because CBT directly targets both the thought patterns and the behaviors that keep panic disorder alive. Part 3, Tools for Diagnosis and Treatment Planning. To track progress and make sure the treatment is working, therapists often use something called the Panic Disorder Severity Scale, or PDSS. This tool helps assess how often panic attacks are happening, how severe they are, and how much they're impacting someone's life. Using condition-specific tools like the PDSS is crucial because they allow for accurate diagnosis and help in treatment planning. If you're a mental health professional prepping for exams like the NCMHCE, keep in mind that recognizing panic disorder, along with tools like the PDSS, can really come in handy. And when it comes to the treatment section of the exam, remember, CBT is your go-to intervention for panic-related issues. Overview and key takeaways. So, to wrap it all up, let's go over the key points we've covered today. Panic disorder is characterized by recurrent, unexpected panic attacks and the fear of having more attacks, often leading to avoidance behaviors. It's important to recognize the potential for agoraphobia, which can develop as a comorbid condition. The most effective treatment for panic disorder is cognitive behavioral therapy, CBT. Techniques like cognitive restructuring, interoceptive exposure, and gradual exposure therapy are used to help clients change their thinking patterns and face their fears. Tools like the Panic Disorder Severity Scale, PDSS, help guide diagnosis and track progress during treatment. Panic disorder can feel overwhelming, but with the right tools and approaches, recovery is very possible. If you or someone you know is dealing with this condition, reaching out to a therapist trained in CBT can make all the difference. Thanks for joining us on this deep dive into panic disorder and its treatments. Remember, mental health is just as important as physical health, and seeking help is a sign of strength, not weakness. If you found this episode helpful, be sure to subscribe and share it with someone who might benefit from understanding more about panic disorder. Want to support this podcast? Show your appreciation through my Ko-fi page at kofi.com/thebabytherapistcc. Until next time, take care of yourself and stay grounded.